Video. Let's keep it in.
Yeah, that one. You need to see it.
They see you, Mike. So I'm gonna hang up.
Hello all. I am Fadila Shaib speaking to you from WHO headquarters in Geneva and welcoming you to our global COVID-19 press conference today, Monday, 1st February. Today's press conference will include special guests who are joining to discuss the launch of a new campaign by FIFA and WHO in support of COVID-19 vaccines, treatment and diagnostics. Dr. Tedros will introduce our special guest shortly. We have simultaneous interpretation in 6 UN official languages plus Portuguese and Hindi. Let me introduce to you the WHO participant. In the room is President Dr. Tedros, WHO Director General, Dr. Mike Ryan, Executive Director, Health Emergencies, Dr. Maria von Kerkhoff, Technical Lead on COVID-19, Dr. Maria Angela Simao, Assistant Director General, Access to Medicines and Health Products, Dr. Soumya Swaminathan, our Chief Scientist, Dr. Bruce Aylward, Special Advisor to DG and Lead on ACT Accelerator, Dr. Kate O'Brien, Director, Immunization, Biologicals and Vaccine, and Dr. Samira Asma, Assistant Director General for Data, Analytics and Delivery. Welcome all. Now, without further delay, I would like to hand over to Dr. Tedros for his opening remarks and to introduce our guest. Dr. Tedros, you have the floor.
Thank you, Fadila. Shukran. Good morning, good afternoon, and good evening. For the third week in a row, the number of new cases of COVID-19 reported globally fell last week. There are still many countries with increasing numbers of cases, but at the global level, this is encouraging news. It shows this virus can be controlled, even with the new variants in circulation. And it shows that if we keep going with the same proven public health measures, we can prevent infections and save lives. However, we have been here before. Over the past year, there have been moments in almost all countries when cases declined and governments opened up too quickly and individuals let down their guard only for the virus to come roaring back. As vaccines are rolled out, it's vital that all of us continue to take the precautions to keep ourselves and each other safe. Be a role model. It's vital that governments enable people to make the right choices, whether it's making quarantine easier to adhere to or making workplaces safer. Controlling the spread of the virus saves lives now and saves lives later by reducing the chances of more variants emerging. And it helps to ensure vaccines remain effective. The COVID-19 pandemic has created an unprecedented demand for high-quality health data. Timely, reliable, and actionable data is essential for governments and health providers to make the best decisions to promote and protect health. The pandemic has pushed even some of the most advanced health information systems around the world to the limit as they try to keep track of COVID-19 on top of other health priorities. Strengthening health information systems is an important part of WHO's work for detecting and responding rapidly to alerts and outbreaks, as well as many other health threats. Today, WHO launched the SCORE Global Report on Health Data Systems and Capacity, which provides a snapshot of the state of health information systems around the world. This is the first report of its kind, covering 133 country health information systems and about 87% of the world's population. It assesses countries according to the 5 aspects of SCORE: survey, count, optimize, review, and enable. The report shows that globally, 4 in 10 deaths remain unregistered. This highlights the urgent need for investments to strengthen health information systems in all countries to support the COVID-19 response and recovery and progress towards universal health coverage and the Sustainable Development Goals. This report doesn't only identify the problem, it also offers solutions. The SCORE package is a set of tools that I call on all countries and partners to use to urgently address the data gaps. We can only make progress if we measure progress. We would like to thank all the countries who contribute to the report and our partners, including Bloomberg Philanthropies, for their support. Strengthening health information systems has been a key part of WHO's transformation process over the past 3.5 years. Another key part of that process has been a new approach to partnerships. WHO recognized that we can only achieve our ambitious goals by working with organizations who reach audiences we traditionally haven't. Last year, WHO entered a new partnership with FIFA to leverage the enormous power of football to promote health. FIFA has been a strong supporter of global efforts to protect football fans from COVID-19. Last year, FIFA contributed $10 million to the COVID-19 Solidarity Response Fund and conducted several campaigns to raise awareness of how to stay safe from the virus, be physically active, and to stop violence against women. Today, I'm honored to be joined by 2 of the biggest names in the world football. Gianni Infantino, the president of FIFA, my good friend, and Michael Owen, one of the most prolific strikers of the past 20 years, who won the Ballon d'Or for the world's best player in 2001. Gianni and Michael have joined us today to support the Act Together campaign to promote equitable access to COVID-19 vaccines, treatments, and diagnostics as part of a comprehensive approach to controlling the pandemic. Gianni, thank you and welcome once again, and you have the floor. Thank you, my brother.
Thank you very much, dear Tedros, my dear friend. Really heartfelt thanks for the opportunity to be here at the WHO today. First and foremost, on behalf of FIFA and on behalf of the global football community, I would like to express my condolences for all the victims of the coronavirus across the world, and I extend my deepest sympathies to the families and friends of those who have lost their lives. And of course, our thoughts are also with all those who are suffering or who have suffered in the last year due to this terrible pandemic. Health is, of course, the #1 priority for everybody all over the world. And we feel at FIFA that it is vitally important that we work and that we act together to defeat COVID-19. FIFA is honored to support global efforts to protect people from the coronavirus and to end this pandemic. Fairness and team spirit are key values of our sport. Football's beauty is, of course, that the sport is open to all people, girls and boys, women and men all over the world. And these same key values, fairness and team spirit, are needed for today's great challenge, overcoming COVID-19. If we act together as a team, we can play our part in the fight against coronavirus. And in that way, football is also calling the international community to act together, to ensure that a level playing field exists in relation to access to vaccines, to treatments, to diagnostics tests, and that this is the case all over the globe. And we want to get this message to a global audience through football, using football as a very powerful tool for good. FIFA is proud to use the upcoming platform of the FIFA Club World Cup starting in 3 days from now, and more generally FIFA's global impact to promote the importance of fair access to vaccines, treatments and diagnostics as part of the ACT Accelerator initiative, an incredible initiative. And to remind people watching our games and to remind the global football community of the importance of adhering to vital public health measures. We all know that the coronavirus does not discriminate. And we ask everybody to play their part in eliminating the threat that this disease poses to all our lives by maintaining the key steps to stop transmission and stay safe from the virus, including, of course, physical distancing, wearing masks and hand hygiene. There are many tactics which are needed to win a football game. At the same time, we must take a comprehensive approach to defeating COVID-19. We must do it all and do all it takes. And we must remember that the only way we will all be safe is if we make sure that everyone is safe. Equality, equity, team spirit, fairness can make this happen. And with this in mind, I'm also delighted that FIFA can once more count on the support of a true football legend to spread this message even in a more powerful way than anyone else can do. Michael Owen is here with us, and he will help definitely to amplify the message together with many other FIFA legends. So thank you, Michael, for being with us. Thank you, Dr. Tedros, for giving us this opportunity and the floor, and we are in the same team.
We are in the same team. Thank you so much, Gianni. And thank you for your continued partnership and support. Now it gives me great pleasure to introduce Michael Owen, who scored more than 400 goals in a 17-year career for club and country. Michael, it's an honor to have you with us today, and over to you.
Well, thank you very much. We are all aware that there have been challenges throughout the coronavirus pandemic, and equally, I would like to share my deepest condolences on behalf of the FIFA legends to all the victims who have lost their lives as a result of COVID-19. Our thoughts are with their families and friends at this difficult and challenging time. It is important that football remains in tune with society and plays an important leadership role in addressing issues that affect us all. It has been clear from day one that health comes first, and this remains the case, but almost in a different way than before. As individuals, we need to remain committed to the 6-step process. The message is consistent, and I am delighted that FIFA's return to competitive football through the FIFA Club World Cup is also being used to remind a global TV audience watching our game of the importance of adhering to vital public health measures. Wash your hands frequently. Cover your nose and mouth if you sneeze or cough. Avoid touching your face. Stay at least 1 meter's distance from others. If you feel unwell, stay at home. Wear a mask and open a window when inside closed rooms. Over and above that, it is important that both of you, Dr. Tedros and Gianni, that you remind the powers that be that there needs to be equity and fairness in access to vaccines. This has been a global pandemic, and globally, we need to give access to vaccination. Thank you both for your efforts.
Thank you. Thank you so much, Michael. And thank you for using your voice and influence to support the Act Together campaign. If there is one thing we have all learned in the past years, it's that when we act alone, we're vulnerable. But when we act together, we can save lives. Fadila, back to you.
Thank you, Dr. Tedros. I would like now to open the floor to questions from journalists. I remind you that you will need to raise your hand using the raise your hand icon in order to get in the queue. I would like to start this question and answers by inviting Graham Denver from Associated Press to ask the first question. Graham, are you online?
Yes, I am, Fadela. Thank you. Thank you very much for everyone in the room for being available to us. A question about the World Cup qualifying games that resume or start next month. We have more than 150 national teams due to be playing, with players scattering all around the world from their clubs to go to their home countries to join up with their national teams. Is this an acceptable risk to be taking at this stage in the pandemic? And is it realistic to keep asking governments to make exemptions for professional sports people in terms of quarantine to make the games work?
Thank you. President Infantino, please, you have the floor.
Thank you. Thank you very much. Well, thanks for that question, which indeed is an important one. We have been developing, together with the World Health Organization, already in the course of last year, so-called back to football protocol. It is obvious, and I want to repeat this here once and for all again, that health is the priority number one. And when we play football, we want to protect the health of all those involved, the players, the coaches, the referees, the officials, the fans, and whatever we do and whatever we will do as well in the next qualifying games for the World Cup or some continental competitions, we will do it by adhering to a clear health protocol which will not put at risk the health of anyone. It is always, of course, a balance that we have to take, but we need to respect the legislations, the decisions of the governments in and all over the world. In many countries, football has come back, in some not yet, in some with spectators, in others without spectators. So the situation is very, very different all over the world. And when you organize national team games, you give as well hope and joy, of course, to people. But everything needs to be done respecting health conditions. So we have our protocol. It is put in place. We will monitor the situation, of course, in the coming weeks. We can see, and we've been hearing it earlier today from Dr. Tedros again, that the situation is evolving week by week or day by day. The international games will be in March. By then we will assess the situation. We'll see where we can play, in what conditions, but we will certainly not take any risk for the health of anyone when we play football.
Thank you. I would like now to invite Sophie Mokwena from SABC, South Africa, to ask the next question. Sophie, you have the floor.
Thank you. My question is directed to the President of FIFA, Gianni Infantino. President, can you elaborate in terms of ensuring that we use football or soccer, as we normally call it in South Africa, to mobilize the nation and ensure that the world is safe from COVID-19? What is it that FIFA will be doing to ensure that the world is safe from the COVID-19, using its footprint around the world, but its popularity as one of the most popular sports around the world, particularly on my continent, Africa?
Thank you very much for the question. And by the way, speaking about Africa and speaking about also the question which was asked just earlier, for the national team games in Africa in November last year, players were coming not only from the 54 African countries, but also from 61 countries around the world, back to Africa in order to play football or soccer, as you call it. Well, what are we doing and what do we want to do? We want to be a responsible organization at FIFA. This is a new FIFA, and we are aware of the responsibility that we have. We are aware of not only the magic of football, which of course is very important to millions, hundreds of millions, or even billions of people around the world, but also about the power of football. And we need to use this in a responsible way. So last year, I think it was on the 11th of March of 2020, when the WHO declared that COVID-19 was a pandemic. The day after, in the morning, I was sitting in the office of Dr. Tedros, asking him, what can we do to help? We are facing an unprecedented situation for everyone, for football, of course, as well, but we want to help. We want to be able to do something. So we started immediately, of course, with only maybe with campaigns, with messaging, with supporting and helping through the voice of football, of FIFA legends, the messages that the WHO and all governments were spreading, because it is true. It is true that many children, boys and girls all over the world, they listen maybe more if you have Michael Owen, who is here today, or other football legends saying that you have to wash your hands, than if it is a big personality of whatever, politics or health or a doctor. And we need to put this power at the service of the community. And that's what we do here as well today. Last year we have been supporting several campaigns together with the WHO. Today we are here to again give our support to the ACT Together process, to have equality, to have fair access to vaccines. It is important. It is important that a message comes as well from the football community. Football means so much to so many people. We are all locked down more or less everywhere. We need to come back to normality, and football can help definitely a little bit to show to the people that we are coming back to normality. And that's why we are here. That's why we are here to cooperate, to pass the messages that the WHO is also passing, that all the governments around the world are passing, and to help and to be part of the team to win this match against COVID-19.
Thank you, President Infantino. Let's come back to Geneva. Laurent Sierot from ATS, Swiss News Agency. Laurent, are you online?
Yes, Fadela, thank you for taking my question. Also a question to Gianni Infantino on vaccine, because you mentioned fair and equitable access. There's been a debate around the Olympics on whether the athletes should be vaccinated earlier than they're supposed to in order for them to be able to participate to the Olympics. There will be two World Cups of club this year. There are these national qualifiers that were mentioned, the World Cup next year. So what's your position on that for the players? And do you think it will be possible to have full attendance to the World Cup next year? Thank you.
Yeah, thanks again. Thanks for the question. Let me answer the last question first. Yes, next year at the World Cup 2022 in Qatar, from the 21st of November to the 18th of December, we will have full stadiums. We must have this, COVID will be defeated by then, or we will have learned to live with it. But if in 2 years from now we are not there yet, then I think we all have a bigger problem than the World Cup. We will not have, because there are many very, very competent people working on it, starting from here, WHO. So I'm very, very confident that the World Cup next year will be incredible and will be the same magic World Cup as all World Cups, bringing really the world together and uniting the world. After a year or more of confinement, of lockdowns, of travel restrictions, I think we are back, and we will be back to where we have to be. With regard to your question about the vaccines, again, if we are here today, if I am here today, it's to amplify the message in relation to fair access to vaccines all over the world. I've been traveling a little bit in the last few weeks to Asia, to Africa. We need to guarantee that everyone can be safe. And for this, we are here to support WHO, to support COVAX, and all the other organizations. But let me answer very clearly to your question. In terms of priorities, the priority for the vaccines is, of course, for the people at risk and for the health workers. This is very clear in our mind. We don't consider football players as a priority group in this respect. Of course, for safety reasons, in the months to come, in the context of international competitions, of travel, and so on, vaccination might be recommended at some point, and the Olympic Games that you mentioned are, of course, only in the summer. But all this will happen, of course, respecting the established order of distribution. And there are people who are at risk, and these people should have priority, of course, to have the vaccines. And it's not the football players or officials.
Thank you. I would like now to invite Khalid Nahar, I believe a reporter from German Sport TV channel, to ask the next question. You have the floor.
Hello, Mr. Infantino, can you hear me?
Yes, we can. You can ask your question.
I have a question about the Club World Cup that has been postponed in China this year. Is there already an availability for a date to get this edition of the Club World Cup, which was planned this year?
Yeah, thanks for the question as well. Well, since you are from Germany, you know that we are starting the new Club World Cup together with Bayern Munich being the European participant in 3 days from now in Qatar. Of course, it's not yet the big Club World Cup that should have taken place in the summer of 2021, this summer in China. We need it, and we did so, of course, very quickly to make space for the postponed European Championship and for the postponed Copa America, who will take place this summer. So we have not yet fixed a new date for the new version of the Club World Cup. What we know is that the current version, with the reduced version with the champion of each continent, takes place next week or this week in Doha, and then at the end of the year in December 2021 in Japan. And then we are looking at next year or the year after to see when the new Club World Cup will take place, and this will be again an amazing competition, again bringing people together from all over the world.
Thank you. I would like now to give the floor to Stéphanie Nibehe from Reuters. Stéphanie, you have the floor.
Thanks very much. Thanks very much. Can you hear me? Sorry.
Yes, go ahead, Stephanie. We can hear you perfectly.
Thank you. I wondered if Dr. Tedros might give us an update of his assessment of the mission in Wuhan so far in terms of access to sites and quality of information or research received from Chinese colleagues there, and whether you still expect them to visit the Institute of Virology. I also note that Secretary of State Blinken said earlier today that China is, quote, falling short in allowing access. Do you share that assessment or have any comment, please? Thank you.
Thank you, Stephanie. Dr. Ryan will take this question, or Maria van Kerkhoff. Maria will start.
Thank you, Fadela. So thank you for the question, Stephanie. So the team is on the ground, as you know, and there is quite a media coverage following them around. So you've seen some of the visits that they have made. They are having very productive discussions with Chinese counterparts, visiting different hospitals around Wuhan. They've had a very good visit to the market, seeing firsthand the stalls and walking through, and we had some good feedback from them of the importance of being able to physically walk through. They've also met with counterparts at the Wuhan CDC and other different levels of the Chinese Center for Disease Control. And they're having very good discussions. But as you know, the plans and the visits that they have provide detailed information, and all of this detailed information requires analysis, which is ongoing between the international team and the Chinese counterparts. And all of that detailed analysis leads to more and more questions. So anyone who's ever been on a mission like this before, and I know there are many scientists watching this as well, knows that the more detail you have on the ground, the more questions you have. The teams will follow the information, they will follow the science, and continue to ask questions and analyze data. They will visit the Institute of Virology, that is being planned, but we do leave them the freedom to decide the visits that they need to make throughout the course of the mission that they have. Their focus is on the early cases, and they're having very good discussions around that. And we will wait to make an assessment for the team to do that themselves. We need to give them the space to be able to carry out this scientific study.
Yeah, and just again, may I remind everyone that this is an international mission, and a mission that was mandated through the World Health Assembly by unanimous resolution asking that the DG send such a mission, which he has done, a preliminary mission in July and the full mission now. There are experts from 10 countries across a range of all of the key areas needed. Maria has outlined what the team are doing, and progress is being made. But as we've always said, all of the answers may be there on this occasion, they may be not. We continue to ask the questions, we continue to push for more data, because as part of any investigation of any infectious disease event, as you gather more information, you get some answers, and then it creates more questions. It's a detective story, and you go through again and you answer more questions. The fact that you have to ask a different question 2 weeks later to a different person doesn't mean that someone is holding back information. It means you haven't asked the right question yet. So that's the process, and that's the scientific process of discovery and finding things out. That's what we're trying to do. Push back the window so we can see the origin of this virus, which is important for everyone. The other thing I would say, many people externally are making references to the fact that they won't accept the report when it comes out, or the report is already not the report they will accept, or that there's other intelligence available that may show different findings. I would ask, right now, as I sit here, no other country has provided any documentary intelligence or other information to WHO. We are out there looking for it. We are in the field with experts from 10 countries looking to find the answers. If you have the answers, if you think you have some answers, please let us know. We've had this here before at this very press conference. People making allusions to intelligence that was available that had the answers. That was never provided. So who's responsible here? And who's acting responsibly? To say that you won't accept a report before it's even written, to say that you have intelligence that is not being provided. I think we need to recognize that at the moment, the international community has a team, not WHO, the international community under the World Health Assembly of 194 countries has a team in the field that Dr. Tedros has put in the field. It deserves the support of the international community, and it deserves to be able to finish its work. Not that all the answers can be found this time, but it's certainly, for me, time for people who say and think they have information to start providing it.
Thank you. Now I would like to invite Bianca Rothier from O Globo to ask the next question. Bianca, you have the floor.
Sorry, boss.
Hi, Fadela. Can you hear me?
Very well. Go ahead, please.
Thanks a lot. Good afternoon, everyone. So my question is about Brazil, because the Ministry of Health said that COVAX would send 10 to 14 million doses of the Oxford vaccine to Brazil from February. But at the same time, PAHO said COVAX would deliver 35 million doses to 36 Caribbean and Latin American countries from mid-February. So it would mean that Brazil would get at least a third of doses from the region. I think there is, let's say, a confusion with these figures. Could you please clarify? Do you have the plan for Brazil? What can Brazil expect from COVAX in terms of doses and distribution dates? Thanks a lot.
Thank you, Bianca. I think we will start with Dr. Aylward. Bruce, you have the floor.
Thank you so much, Bianca. And as we mentioned last week, the COVAX facility now is getting a better sight line on the timing for the the emergency use listing of the products that it has in its portfolio, and the key ones are going to be the AstraZeneca products that are going to come out in. Hopefully be available from February. So what Bianca is referring to, just so everyone is aware, is over the weekend, the COVAX facility has looked at the available volumes, and then it's calculated for all of the participants in the COVAX facility, all 190 countries, what are what they call indicative allocations. So how much of that product should be available to those countries starting from late February and then running into March and right through the first half of the year. Now, Bianca, I wish I could give you the exact numbers, but as there were 190 letters that went out yesterday, I'm afraid I can't remember exactly what's being allocated to which. And for clarification on that, I think the information's just gone out to the countries over the last day. They need a couple of days to reconcile that. And remember as well, the numbers that went out are indicative volumes, so they're ranges. So for one country, it could be from 2 million to 3 million, depending on what the final volumes from the producers are, whether or not all these products get through emergency use listing, et cetera. So I don't know what's exactly happened in terms of the numbers you're referring to, but sometimes people read the top end of the numbers and another audience may read the bottom end of the numbers, but there may be a couple of different reasons if they're not aligning. In the case of Brazil, you may be as well aware that they also have bilateral arrangements on the AstraZeneca product. So again, I'm not quite sure of the absolute specifics, but I think the good news is that the COVAX facility has been able to go out to all the countries that are part of the facility over the weekend, give them the indicative volumes and a sight line on what they look like from February, which is a clear indication, of course, that that is the timeline to start delivering from the facility to multiple countries.
Thank you, Dr. Aylward. I would like to invite Dr. Simao to add some elements. Dr. Simao.
Thank you, Fadela, and very, very briefly, Bianca, because this indicative allocation is actually based on projections of what's in the contract. But it also takes into account, we will have to take into account the regulatory aspects. These vaccines will also need to be approved for emergency use listing in the countries, or emergency use authorization in the countries. And also we are still waiting to see the actual projection of how many doses will be available in February in March from the manufacturers, right? Because you will have seen there are some glitches in the manufacturing of the different vaccines at this stage, and there may be less volumes to be allocated. We'll know that in the next few weeks. But like Bruce said, this is an indicative allocation. There's a range, and we put it out so that countries know it will be coming, right? But the volumes have still to be addressed. The number of doses will still need to be taken into account according to the supply when the time is ready. Thank you.
Thank you, Dr. Simao. Dr. O'Brien, you have the floor.
Yes, I'd just like to make one other point. For self-financing countries in the facility, countries also informed the facility what fraction of the population they wanted to cover, and not all countries elected to cover 20%. Some of them went lower, some of them went higher. So the indicative allocations for any one country also represent, if they were a self-financing country, what their desire was that they communicated to the facility at the time when they committed to the facility. So I think it's just important that when any comparisons are being made across countries, there are a number of features that go into these indicative allocations. Thank you.
Thank you, Dr. O'Brien. I would like now to invite Tamara from Georgia to ask the next question. Tamara, you have the floor. Tamara, you have the floor. Can you please unmute yourself?
Yeah, thank you for this opportunity. I'm from Georgian TV company Formula, Georgian journalist, and I want to ask you that 2 days ago, Prime Minister of Georgia, Mr. Georgi Gacharia, made a statement that he had a conversation with Mr. Tedros, and that Georgia can expect the first batch of vaccines at the end of February. Can you tell us more details about this conversation? And of course about the vaccine, when we can expect, how many doses, when can we expect, and which vaccine can also Georgia expect? Thank you for this opportunity.
Thank you, Tamara.
Thank you very much. I think this is a very detailed, what do you call it, need for information. And it's very difficult to communicate with countries on details of things through media. We have a channel to communicate with each and every one of them. So I'm really sorry, but it would be better to communicate through that channel, not through media. Thank you.
Thank you, Dr. Tedros. I would like now to invite John Zarakostas to ask the next question. John, you have the floor.
Yes, good afternoon. Can you hear me? Hello?
Yes, very well. Go ahead, John.
Yes. My question is basically, perhaps Dr. O'Brien can answer it. I would like to know, what is the current production capacity for COVID vaccines? What have the manufacturers conveyed to the WHO will be scaled up? And if we have a time period, because in previous influenza crises or pandemics, we had a good picture from industry where they were on the production. It doesn't seem to be the case right now.
John, I'll take the floor only to wish you a Happy New Year, and then to pass on to someone who will have a much better answer for you than me. Okay.
Let me start off, and there may be others who would like to contribute as well. The COVAX facility has committed supply of over 2 billion doses for 2021. The month-by-month indicative supply projections are available on the COVAX facility website. We'll be happy to post those so that you can easily access them. They are based on, not just for the COVAX facility, but frankly, the supply projections for all countries are based on projections from manufacturers about what their expectations are for yields of the vaccines and for the timeline of those yields and being able to produce the vaccines. As you know, for biological products, there is no certainty around being able to secure those yields with 100% assurity. And we are hearing about challenges that manufacturers are having on their production. So again, we have to emphasize that those month-by-month projections for the vaccines that have secured contracts are what they are. They are projections. And we are all in the place where we hope that those production expectations are met. In addition to the over 2 billion doses, there are also first right of refusal options on another 1 billion doses in the COVAX facility for products that have not yet completed their clinical efficacy trials that are supported by for research and development, and therefore, as part of the contracts for support of that R&D, have the right of first refusal for the COVAX facility. And then thirdly, there are negotiations that are ongoing with additional manufacturers by the COVAX facility to secure additional doses. So I think, I hope that gives you a sight line for where you can find the month-by-month information and what that information actually means. And I'll turn that over to anybody else who might want to contribute.
Thank you, Dr. O'Brien. Dr. Aylward?
No, I was just going to say hi, John. It's Bruce here. Yeah, the simplest thing, guys, there's a fantastic resource on the web. Simplest thing is just Google COVAX forecast supply or supply forecast, and then you can go in and click on it, and it gives a great breakdown. Like, I just thought it'd make it a little easier for people to find it. What it shows is by quarter what the projections for that 2.2 billion doses look like, and then it also provides you breakdown in terms of regions, WHO regions, an AU view, a view by product. So it's quite a nice document that Gavi have posted. But the best part of the document is what's on the right-hand side of each page, because on each page it has caveats and it explains what the challenges are around the licensing of those products, the yields, etc. So I think Gavi and the facility have done a great job trying to give people as much visibility as possible on the pipeline, and will continue to do so as they go forward. So that can be found there, but with the caveats on the right-hand side are what are so important, right? We're dealing with a biologic process here. All the manufacturers are working flat out to try and optimize their volumes, but at the end of the day, there are challenges as you move from developing clinical trial lots that you use for your trials to the commercial scale production. And often you run into problems with yields and other aspects that just mean your volumes end up being lower, as we've seen to the disappointment of many recently, but that's part of the challenge. Everyone's working very hard to get as much product as possible out there, but there will be setbacks and bumps along the road as we go.
Yeah, just to supplement that, you know, as Kate and Bruce have said, manufacturing at this scale is a challenge. We're, you know, wanting billions of doses suddenly, and the world is not used to manufacturing these many vaccines. So one thing we would like to encourage is for developers who now have vaccines that have passed the clinical efficacy trials to really explore how they can expand manufacturing capacity by partnering with other manufacturers that have spare capacity in different parts of the world. And this is something that would be useful for this pandemic, but also beyond that, because I think it will be building capacity in different parts of the world. And we set up a mechanism, the Director General announced the creation of something called the COVID Technologies Access Pool way back in May 2020, and that was really to encourage and enable anyone who had products, who had technology, who had knowledge or data that they wanted to share, could do it through that, thereby linking producers and developers who have the know-how with those who actually have the capacity. And we also have to remember that vaccines need the raw material. They need to be filled and finished and packed, but they also then need the syringes and the vials and everything that goes with getting the vaccine into people. So side by side with investments in manufacturing of the actual vaccines, we also need to make sure that we have the syringes and needles. and the other materials that are needed. And that's, the COVAX facility has been focusing on making sure that all of that happens as well. But I think more sharing of technology and looking at innovative ways of increasing production would help meet some of the shortfalls that we're seeing today.
Thank you, Dr. Swaminathan. I would like now to invite Isabel Sacco from FA to ask the next question, maybe the last one. Isabel, you have the floor.
Good afternoon, everyone. I would like to ask Dr. Alward about if maybe he has in mind information on the number of vaccines that the indicative allocation that he mentioned by regions. Maybe he can provide this information. And if I understand that it was said last week that this information will be available public, so I would like to know where and when this information will be accessible for all of us. Thank you.
Hi, Isabel. Thank you for the question. And sorry, I may not have been clear enough in an earlier comment. So about 10 days ago, the COVAX facility published on the Gavi website the allocations, indicative allocations by region and by month, starting from February, March period right out through. So if you go on to the Gavi, actually the easiest way to find it is to Google it. Just Google the COVAX supply forecast. So if you Google that, then you will find there's a link to a document which is updated regularly. We're going to try and update that every week or 2 weeks as numbers change. And what that document will provide is the indicative allocation by month and by region. So you'll be able to see for each of the 6 WHO regions how many doses they can expect during each of the months. Now, as mentioned in the answer to the last question, there's a lot of caveats or potential considerations that we have to bear in mind, because producers may have smaller volumes than they're hoping for. There may be delays in providing emergency use listing of a product, et cetera. So these may change, but the indicative allocations are being published now on the site, and they can be found there. So if there's any trouble, just contact our media folks and we'll be able to make sure you have access to that important information. Again, with the caveats that these are very much indicative numbers, and you're all seeing the challenges some manufacturers are having reaching the volumes that they've committed to. So these are subject to some change as we go forward, especially in the short term. The other thing that was referred to by some of our earlier speakers was indicative allocations at the country level. But as the Director General said, those are direct communications to the countries, to the ministries of health, between the facility and them, and BEST is working with them directly to understand what their indicative numbers could look like. But again, bearing in mind all the caveats, and I think it's going to be so important and helpful, also with the media, I'm not going to tell you your job, but I think the more we can help populations understand that, this is indicative, this is if everything goes right. If there's problems, then the numbers will be lower and smaller. But everybody's doing everything possible to optimize those numbers. It all comes back to what Mike has been saying all along, and Dr. Tedros and Maria, though. In the meantime, we've got social distancing, we've got masks, we know how to prevent the spread of this disease, and we have to rely on those during this period, as tough as that is.
Dr. Ryan, you have the floor.
Yeah, thank you, Bruce. You're absolutely correct in terms of what we need to continue doing. But just also on that, with relation to vaccines, certainly Kate and her team and the vaccination team and our teams working in terms of country support with our regional platforms and the World Bank have been working on these vaccine readiness plans at country level, and they're all being currently uploaded into the public domain too. So everyone can see, especially donors and others, what it's going to take to deliver those vaccines. Because again, we've seen, even with small numbers of vaccines in some countries, part of the problem has been actually delivering those vaccines, generating the vaccine demand, doing the proper and safe vaccination, monitoring the implementation, and doing it properly. So vaccine is one part of the solution, being able to deliver those vaccines efficiently. So we would ask all donors and all investors and all financial institutions to look at those national vaccine plans and see where you can invest. It's not just an investment in vaccine we need. We need an investment in the country's capacity to deliver those vaccines sustainably, and also that will obviously help strengthen core immunisation programmes as well at country level. So I think there's a good investment there for everybody to support.
Dr. Van-Kerkhove?
Yeah, I don't want to answer the question. I just want to take the opportunity to, as the least sports person up here, to thank Mr. Infantino for the leadership that sports players play around the world. I mean, one of the things we're learning is about being a good role model. And you brought it up in your answer that sports professionals at the professional level, but also at high school level, university level, even the little kid level, being a good role model is what we really need to see right now. It's very, very hard to keep up all of the hand hygiene and the mask wearing, but if we have sports players, we have leaders all over the world to show us that it's cool to do, it helps, and we can use all the help we can get. So as the least sports person up here, I wanted to say thanks, because I didn't have an opportunity to say it before.
Thank you. Dr. Tedros, you have the floor.
Okay, thank you. So Maria had already said what I wanted to say, to thank Gianni. So I thank also all who have joined today, and thank you so much, and all the best until we see you in our next presser. Bye. Gianni, would you like to say something maybe as a closing?
Gianni?
Yeah.
The last word before we go. Well, of course. Yes. Tedros, thank you very much to all the team here. I mean, as a, how should I say, as a normal person who, like billions of those following this conference, is watching every day what is going on, I would simply like as well to commend all those persons here and all those who work to make our lives better, to save our lives. We want to play a little part in that, but what these ladies and gentlemen here are doing, the medical staff are doing, this is just incredible. We cannot underline it enough. And when I hear, and let me just say that as well, when I hear, you know, sometimes criticisms here and there, some were mentioned even today, I can just appeal everyone. This is an unprecedented situation. We have to work together. We all make mistakes, everyone makes mistakes, but we have to work all together. When I hear that vaccines have been developed in less than 1 year, I mean, this is incredible. This would not have happened without the great work of many people. We have to recognize that. Now, today I heard that there are around 2.2 billion vaccines, right, available. It's not enough. We need to do more, which means we have to work together. Let's join forces. Let's work all together. Let's support WHO, but all those who are working to save our lives. That's why we are here. That's why many players, football players, legends, sports persons, famous or not famous, are embracing this challenge and this fight all together, because united we'll overcome this. And for me, this is the most important message. Let's continue and let's win this match. Thank you very much.
Thank you very much.
Thank you, President. Just reminding journalists that you will receive the DG speech and the audio file of this press conference just after that press conference, and the transcript will be available on the WHO website tomorrow. Thank you all for your participation, and see you next time.